Good afternoon, everyone. So this study, basically, it's a real-world data collection. So it has been presented by Suresh Ramalingam at the ISLC 2022, this year only. And what he have done, he has taken this all data from the Guardant 360 assay or Guardant 360 diagnosis assay. And from there, the whole patients, their data collection has been done. And all the patients who were started on osimertinib and further progressed, their data they have got, and they have revealed that data and showed what is the real world evidence of the mutations which are occurring in the case of the patient who are receiving osimertinib. So since it is the most common TKI at present, after osimertinib, this study has shown that C797X mutation is one of the major resistance mechanism. Before this, what in 2019, the Leonetti et al. Also presented that MET amplification is one of the most common thing. MET amplification is the first most common mutation which is occurring, followed by those of the EGFR C7X. Otherwise, the transformations are also occurring. So in case of osimertinib or any TKI, there are two types of mutation, as we say. It's the on-target and the off-target mutations. The on-target, that is which is occurring in the EGFR lineage only, and the off-target one, which are the others like MET amplification, BRAF, PIK3CA, KRAS, CCNE, or if there is a occurring of a transformation in these group of patients. So the most common what is before that was MET amplification and CCNE amplification, and there was the EGFR till last studies. So this real world data is from the Guardant 360 cfDNA, and what they have done that they have collected the data regarding the diagnosis, treatment, procedure, demographic and pathology that they have got in their database only. And out of 65,000 patients data, what they have got, the most common of which were exon 19 deletion, something around 5,000 patients, and exon 8858 are 3,800 patients. Out of these patients, osimertinib, the patient, around 4,000 patients have received osimertinib. And with this, the patient who have undergone Guardant 360 repeat testing, there is something around 2,000 patients on osimertinib that they have collected the data. And these osimertinib patients, around this 65% were those who have received osimertinib in the first line, whereas the other 34% have received osimertinib in the second line, with a median follow-up around 2 years for both groups. And in this, they have found that C797X mutation is something around 6.5% in the first line, but in the second line, it is just doubled. It is something around 13.9% in this group of patients. So there is also a dynamic variation in the case of the mutations. So if the mutation is occurring just after starting osimertinib in the first year, it's a different mutation. If it is occurring after the second year, it is a different mutation. So what is most commonly seen that the MET amplification is the most common acquired mutation resistance mechanism occurring in the first year of osimertinib. So during the first 6 months or the 7 months, it's the MET amplification mutation which is occurring most common. But as the patient further takes osimertinib, right from if you see something around 18 months, the curves changes and it is going to the C7X mutation, which becomes the most common as compared to the MET amplification. So the timing till how long the patient osimertinib is taking, the resistance mechanism varies according to that. This has shown. So, and if the patient is taking the second line osimertinib, in that case, it is much increased, that the magnitude of the mutation is much higher in the case of second line osimertinib intake. So the median time of development of mutation is such like that the first mutation to come is CCNE1 amplification. It is around 9.1 months. And for MET amplification, it is 10.5 months. Whereas the EGFR C797X, it is something occurring around 16.8 months after starting off osimertinib. So at the different time frame, the type of mutation occurring is varying in this group of patients. So now this study has shown that it is the C797X is the most common on-target or off-target resistance mutation. The cumulative incidence is something around 12.5% in this group. So after the first line osimertinib, this mutation is something around 8% incomparable to CCNE, which is around 7.9%, and MET amplification 6% in this group of patients. Whereas after second line, this is just doubled to something around 18%. Patient is having the EGFR C797 mutation as compared to the CCNE and MET, which is hovering around 10 to 8% in these group of patients. So what have they concluded that it's a MET amplification is the most common initial resistance mechanism in the first line, in the first year of the treatment, but from the second year onwards, it's the C797X mutation. where it is something 1.25 times more common than MET amplification after first line and 2.4 times more common if the patient after second line osimertinib in these group of patients. And the cumulative incidence is something around 12.5% of the patient may having this C797X mutation. And this further addresses the novel, we need to have a treatment based on this. With the most common mutations are C797, MET, and CCNE in these group of patients. But there are major limitations to these studies because they have just collected a data from basically a commercial company, and they have many information which are missing, and whether they have got exact data or not, they are exact representative or not, they are not sure. But still, this clearly shows that EGFR 797 is the important target, which is coming after osimertinib treatment. We have to take care of that. Yes, thanks.